The famous Canadian psychologist Jordan Peterson has checked himself into a rehab facility in New York according to his daughter Mikhaila Peterson. Peterson, who is known for authoring the best-selling self-help book 12 Rules of Life and rose to fame for his controversial views on transgender rights. He turned to rehab, seeking help to deal with withdrawal symptoms from the anti-anxiety drug Clonazepam, which is branded under the name Klonopin. This medication was prescribed to him by his doctor. Jordan Peterson began taking the anxiety medication to deal with stress from his wife's battle with cancer and her other health problems earlier this year. After quitting the drug cold turkey, he experienced horrific physical withdrawal symptoms with increasing anxiety. He has now decided to check himself into rehab because he didn't want to burden his family and wants to get off this as quick as possible. I was recently watching the Joe Rogan podcast, which was filled with misinformation and confusion regarding this medication. Here's a brief clip from that podcast.
Jordan Peterson just checked himself into rehab.
What?
Yeah.
Whoa. For what?
He got on an anti-anxiety Klonopin, anti-anxiety medication because his wife is
that's heavy
dealing
stuff.
with
Wrong one.
Klonopin. It sounds like a drug that people take.
My friends took that in high school. That's no Xanax. That's like heavy duty.
What is it like?
It was just like it shut you down. It was it was just.
Is that one of the ones that
you
they
drink
use
on it, you're ruined.
To take people off of heroin?
That's methadone, I think.
But isn't there another?
As you can see, there is a lot of confusion regarding what Klonopin is and how it works. In this video, I will be giving you a brief overview of this medication to help give you a better understanding of what is going on with Jordan Peterson. I hope you'll be able to apply the information provided here to help individuals in your lives that have also struggled with anxiety and use this medication or similar ones. The drug Jordan Peterson was taking is called Clonazepam, and as previously stated, it is marketed under the name Klonopin. This drug is from a class of drugs called Benzodiazepines, or benzos for short. You have probably heard of other drugs in this class. Some of them are Valium, Ativan, and Xanax. These drugs all differ by their duration of action. There is short, intermediate, and long-acting classes. Benzodiazepines are sedatives and tranquilizers which are prescribed to treat symptoms of insomnia, anxiety, panic, seizure disorders, muscle tremors, and muscle spasms. These drugs work by affecting neurotransmitters in the brain, basically altering the user's brain chemistry. Neurotransmitters are chemicals that neurons in the brain release to communicate with each other. The specific neurotransmitter that benzo drugs work on is called GABA. The neurotransmitter GABA tells nearby neurons to suppress their activity. The excessive activity of nerves is the cause of anxiety and other psychological disorders. So, benzodiazepines work by reducing the activity of neurons in the brain by enhancing the effects of GABA. It's also interesting to consider that alcohol works by activating GABA in the brain as well. That's why both benzos and alcohol are referred to as depressants. The most common side effects associated with these drugs are sedation, dizziness, weakness, and unsteadiness. Some less common side effects are sleep disturbance, aggression, memory impairment, and depression. In general, benzodiazepines are well tolerated and are safe and effective drugs for short-term use. However, they are not intended to be taken long-term, as prolonged use or abuse can cause the brain to become both physically and psychologically dependent on them. These drugs are also much more active in seniors and should not be used in these patients. Because all benzos can cause physical dependence, they are considered to be very addictive. Physical dependence is when your body feels as though it needs the drug in order to function. In short, your brain is accustomed to the drug. This means that abruptly stopping the use of the drug causes your brain to panic since it cannot function without it. Since the benzos initially function to depress brain function, the brain now rebounds to become hyperstimulated and agitated. Quitting the Klonopin abruptly or going cold turkey is what caused the withdrawal symptoms Jordan Peterson experienced. In the medical setting, medications with high physical dependence are tapered off slowly to allow for the body to adjust to not being stimulated by them. The symptoms of withdrawal depend on how long the benzo was taken and can be life-threatening. Short-term withdrawal symptoms are sleep disturbance, irritability, increased tension and anxiety, panic attacks, hand tremor, shaking, sweating, difficulty with concentration, confusion, and cognitive difficulty. These are the most common symptoms of withdrawal, however there are many more, less common symptoms. If benzos are taken continuously for longer than a few months, stopping the therapy suddenly may produce seizures, tremors, hallucinations, muscle cramping, vomiting, and sweating. In order to avoid withdrawal symptoms, the dose of benzos should be tapered off slowly. By checking himself into a rehab facility, Jordan Peterson has taken a step in the right direction. This is no doubt a very wise decision. He will most likely be initiated on benzos again, and the dosage will slowly be tapered off. The prognosis is typically very favorable when the process is under professional medical surveillance. I hope this cleared up everything regarding this situation and brought some awareness to drug addiction and the importance of seeking out medical help. I hope Jordan can make a speedy recovery. Get well soon, Jordan Peterson.